Bismillahirrahmanirrahim. I'm Dr. Mohammad Ahmed, and today I will explain about Cauda equina syndrome in dogs related to neurology. This is the compression of the spinal cord at L7 and below. At L7, the spinal cord ends and the host tail-like nerves come out from that point and provide supply to the legs, perineum, bladder, anus, and other structures. What causes compression at that point are the different factors. One of the factor is stenosis of the lumbosacral vertebrae or the lumbosacral structure, osteophyte formation, disc protein in that point, ligamentum flavum hypertrophy. So this will cause compression. Now there is a motor as well as sensory supply to the tail, perineum, bladder, hind limbs. So compression at that point will cause weakness in the hind limbs, such as inability to rise due to extensor muscles are weak or are not able to have correct information from the nerves. So as bunny hop, as the animal has weakness in the legs, so it uses both of its legs. The tail will wag, like there will be no tone in it. On pricking the perineum area, there will be no twitching or no sensation in the animal, and there is a urinary incontinence. The bladder will have lower motor neuron signs, and it has overflow incontinence. So these are some of the problems that is related to the Cauda equina syndrome. Due to the compression of the spinal cord at that point, this could lead to edema, inflammation, congestion. In long terms, it causes demyelination. If it even goes longer, that could lead to axonal degeneration. The tail is paralyzed because the stenosis, osteophyte, ligamentum hypertrophy, or disc protein is compressing caudal vertebrae 1 and 2, and that supplies the tail, and it causes the tail paralysis. Similarly, pelvic nerve and hypogastric nerve, they provide sensation to the bladder, and pudendal nerve provides sensation to the anus. So these points will have weaknesses, and the extensor muscles of the hind limbs are also weak due to compression at these points. What are the possible treatment for these disease is to give strict rest, because it will allow the lumbosacral point to stay stable, or it will not put pressure at that point. The second thing is the reduction of the weight. Again, weight reduction will not put pressure at lumbosacral vertebrae. The other is to give NSAID, which is a non-selective COX inhibitor like carprofen, and they will reduce pain and inflammation. Giving steroid will reduce inflammation and edema, and for neuropathic pain, that suppresses alpha sub2 units and will not allow the neurotransmitter to come into the space and cause excitation. So these are some of the management. If the animal is not managed with these medicines, then the surgeries like laminectomy, which is the removal of the roof of the spinal canal. The other is the feminotomy. This is the foramen. Men's space is increased. This is how this disease is managed.